Hello, everybody. Welcome back to the Holistic Pharmacy Podcast. And today I have another exciting guest on the show. Her name is Dr. Nammy Patel, and she's a graduate of the University of California School of Dentistry. She's a champion for her patients, fellow dentists, hygienists, and team. And she was one of the first people to put forth the movement to bring eco-consciousness into the dental world. She specializes in green dentistry, which is a holistic, functional Ayurvedic approach to dentistry. So I'm so excited to get to all the hot topics that we have today going on around oral health and microbiome and the connection between the body and the mouth. And Dr. Nammy, let's start you off by just telling us a little bit about how you got into dentistry in the first place.
Oh, thank you so much for having me. I'm really excited to be here and really share with you my passion, which is really the oral systemic connection, how the mouth is related to the rest of the body. It's interesting. I always say destiny got me here. There's been so many events of my life that have, contributed to the way I practice. My first, reason is I made a green eco-friendly practice because I grew up as a Jain. Jainism is a religion in India. It's focused on ahimsa, which is nonviolence, and being really conscious of, your environment and also the materials you're utilizing in a way of consciousness. So that's the real reason I started green dentistry. And as I evolved through my career, I started focusing more and more on the oral systemic connection because my brother, who was 33 years old, had passed away from a heart attack. And so, exactly, not obese, not your typical person, that you would think about, but 33 years old and passed away from a heart attack. So it got me to thinking about what's missing in preventative medicine, what's really missing in diagnostics, what's really missing in our society right now, and in healthcare, really. And U.S. tends to, we like to think that we are at the forefront of healthcare, but really I come from Ayurveda, which is 5,000 years of wisdom and knowledge that actually really helps us really look at how to be preventative, how do we create better lifestyles so that we're living longer. We're able to chew better, our bodies are functional and we live longer. I mean, that's what we really want. We want to live and live well.
Yeah, first of all, please accept my condolences. I can't imagine your loss with such a young person. I actually had a friend who was younger than that, pass away pretty recently too from cancer. And I think it's just so sad that nowadays the life expectancy of us now is going to be greater than what's predicted for our children and future generations. And so I think what you're doing and what you're talking about and the sustainability question, I think we all should have that as top of mind as we continue to rebuild the system and the structure that are taking that away from us and from our children. So Dr. Nammy, what's been your biggest learning curve of how you've had to rethink and redefine dentistry?
That's a great question. Thank you so much. I feel like the biggest thing I, got out of dental school and it was basically, if there's a hole, let me fill it, That's been the traditional model of dentistry and that's what people think is when you're going to a dentist, you just want like a filling or a cleaning, What's really got me really going is that I had to start really thinking at root causes, really looking at what is the root cause? How is our saliva? We look at blood, right? And we look at that as a biomarker for things. We look at iron levels, things like that. But the saliva is the biomarker as well. Looking at the biomarkers that our saliva gives to us, we can actually figure out the bacteria that cause heart attack, diabetes, cancer, Alzheimer's, arthritis. And, the second piece of it was the reason being looking at saliva is because we're swallowing 5 gallons of saliva every single day. Just like the blood circulates all of our nutrients in our body, the saliva is actually a really important gateway to our immune system. Really looking at how, when we swallow these 5 gallons of bacteria every single day, we want good bacteria that help produce nitric oxide, that help digest food, that help us heal. Because if we have the bad ones, you know, we've got fungus overgrowth, we've got parasite overgrowth, we've got a lot of this overgrowth that leads to a lot of disease and dysfunction. So really the biggest learnings that I had to really go through is, you know, functional medicine. I went through functional medicine training through the Kalish Institute and really learning how, you know, the immune system is a critical part. What is the gut-brain axis? What is the gut-mouth axis that nobody talks about? What is the mouth-brain axis that nobody talks about? And really deep diving into this microscopic, magnificent world, you know, is really looking at what is really going on with our body at the molecule or the cellular level, and how can we change that. And that's very different from a dentist, right? A dentist is like, hey, if there's a hole, let me fix it. I can fix that in 5 minutes, no big deal, right? But really going down to like, hey, how can I help you prevent Alzheimer's? How do I help you slow the rate of SIBO? Or how do I make sure that it doesn't come back? Because most patients are going to their functional medicine doctors and getting all this work done, but then they relapse. And it's like, well, why are you relapsing? It's because we never fixed the root. So let's look at the root. And in dentistry, you know, there are 2 most important things. One is your microbiome, which is like your blood serum. I compare them the same, the biomarkers. The second most important thing that we need is actually nose breathing, is nitric oxide. We now know nitric oxide helps prevent heart attack, diabetes, cancer, Alzheimer's. It's like your BFF basically. And, you know, nitric oxide hasn't really been, you know, nobody really even looked at it. The only reason people looked at nitric oxide was, you know, erectile dysfunction, you know, that was the only thing people were looking at. But in reality, nitric oxide, which dentists can help you get more of, by the way, naturally. One, through breathing through the nose. Second is to making sure you have good bacteria that help you convert nitrate to nitrite in your stomach. And that whole process is really important in dentistry. And people are like, and usually even professionals sometimes aren't like making the connection. We're like, wait, tell me more, you know, wait, I forgot about that because we learned it way back when. But again, in application, it is, you know, there's so much that's out there, and dentistry is a really small piece that really has a big, big impact at the root of preventing disease.
Wow. Yeah, you gave us a lot to think about right there. So let me ask you, in your opinion, as a dentist, how is the body connected to the mouth, and what can a dentist offer for that?
So the mouth is connected to the body in 2 different ways. The first most is the saliva test, really looking at what specific bacteria that exists. And also it's important to look at the type of dentist you go to too, because some dentists may look at the type of bacteria and say, hey, let me put you on some antibiotics to get rid of these bacteria. But in actuality, especially if somebody who's, you know, really interested in herbs and natural modalities, we like to use laser therapy. We like to use ozone therapy in order to be able to balance that microbiome again, so that when you are swallowing those 5 gallons of bacteria, they're going to the gut and you have good, healthy bacteria that actually helps your immune system work better, helps you think better, age gracefully, and feel more comfortable, you know, because the reality is when we have dysbiosis, that's what disease happens. And when we have dysbiosis, it actually opens up our enteric lining to let all these microbes in, which are normally protected by the gut. So if we have a good, healthy mouth, it's going to help protect our guts. And that's what we really look at. And one part is the microbiome. The second part is nose breathing. What we always forget is right on top of our front teeth here is our nose. And they're connected because we're connected through bones, you know, like our, you know, upper palate is connected to our cheekbones, which is connected to our head, connected to our TMJ. And really, when we start looking at, you know, the skull is connected by sutures, you know, the connection is really important, because if we look at people who have had braces or people who have thumb sucked, we will find that they cannot breathe through their nose. And the reason being is that their palates that should be normally flat end up being really like vaulted or V-shaped. So those of you who may be listening, we're actually talking about the way that the roof of your palate is. We want it to be nice and flat so that the tongue can rest on top. And then when that tongue is resting, it allows the sinus cavity to actually make sure that it can breathe really well, and then also make sure it drains really well, because our sinus cavity, our nose, is actually filtering a lot of toxins from the air, and then also taking that oxygen and convert into nitric oxide that our body can use. So our upper jaw is really important in those aspects. Our lower jaw is actually really important because it's part of our windpipe. We forget that the jaws, everything is connected, and it's not just this area, it's this area connected to this area, connected to this area. And then also on the bottom, where our lower jaw is connected to our neck. And if we have sleep apnea, or if our, jaws are really narrow, which means our windpipe will be very narrow, it's going to cause a lot of concern. And one of the biggest things that we see, especially as we get into 40s, I don't know about you, I'm in my late 40s here, but I have so many friends who have a stroke or who have a heart attack, and the medical doctors are not screening for sleep apnea. They're not screening for upper airway resistance. They're not really looking at, hey, what really is going on here? These are young, healthy individuals, and a lot of them professionals. Yes, we have stress, but it shouldn't be where it kills you, right? Stress is, our bodies are designed to handle stress. We were in the forest at one point, and we had a tiger who was ready to attack us anytime. Our bodies knew how to work with that. And so, really looking at what are some preventative ways that we can live longer and really prevent disease, and, be minimalistic. My goal is to not replace a pharmaceutical for a nutraceutical, but really, how can I make your body work well on its own? Because it is an amazing machine. It is designed to work well. It is fascinating. We're still learning about it, and there are ways that we can optimize and maximize the way that our body works. And that's that's my passion. So I love doing that. And, a lot of different learnings,
Yeah. Well, I hope the viewers that are watching the video realize that you must be doing something right, because you look absolutely stunning, and I would never guess your age.
Oh, thank you.
That's first of all. Secondly, from your perspective, I'd love to get your take on what you feel the root causes are. And I think you've been touching on some of them for both mouth disease and teeth decay and all of that. And then also how that's connected to the diseases of the body.
Sure. The number one reason, if we look at root causes, a couple of things have happened in society. We have evolved, in the last 100 years, moms went to work, children were not being breastfed. We are, not feeding our children like real vegetables. We're giving them baby food. So the development of the jaws is really important. So I always like to say there's multifactorial reasons, right? The first one is going to be genetic. Genetically, people have different jaw structure that makes a massive impact. The second is actually the intervention of braces as children, which is a problem. When children go through braces, their jaws are constricted. If their jaws are constricted, does not allow them to grow as they naturally should, it's going to lead to disease in adulthood. It's going to lead to SIBO. It's going to lead to anxiety, depression, ADHD, and they're all airway concerns. Now, if you trace it back even further, we can actually go back to breastfeeding. One of the things that happens with breastfeeding is when the baby suckles on the breast, it actually signals the sinus cavity to grow and the windpipe to grow properly. And the tongue is in the correct position. And when that is correctly done, and most society has breastfed children for 6 months, we actually need to breastfeed children for 2 years, because they're still growing in that timeline. And that timeline is when their sinus cavity develops properly. And their functional airway and their tongue posture is developing properly. So that suckling of the breast is actually a great signal for the rest of the body to grow, for the sinus cavity and the functional airway to grow. That's where it starts from the first step. The second is the use of pacifiers. Pacifiers are, as much as we wanted to design it like a breast, it does not make the body work as hard as it does when it's actually breastfeeding. So use of pacifiers has changed the way that the upper arch and the lower arch develops. Now, you add in another thing. Children want comfort. So a lot of times they will suck their thumb or will suck their fingers. That also leads to disease. That also allows their palate to grow the way we don't want them to, that high vault, that high arch, so that tongue can't rest at the roof of the palate. They're not getting that nitric oxide. And then the last reason is actually evolution. One of the things that we found is that when we were, our ancestors were closer to the ground. So what actually happened is that our sinus cavities were really big and our heads were a lot smaller. But now we're in the world of AI. We're using our brains so much so that our brains are getting bigger and our sinus cavities are becoming smaller and our jaws are becoming smaller. The other thing is also wisdom teeth extractions. When wisdom teeth are being extracted, the purpose of teeth is to keep the bone in place. When wisdom teeth are being extracted, the bone starts resorbing in the back jaw, so it makes the jaw smaller, which leads to higher chances of sleep apnea, upper airway resistance in their 40s, 50s, and 60s. So that's the main reason why this is happening from, I would say inception to, let's say, 14, 15 years old. Now, second piece of this is actually older age. One of the things that happens after 40 is that we are aging and aging gracefully. It's a process we can't stop. And that process is what happens is as we age, our collagen fibers unravel and we start getting wrinkles. Now, the same thing happens to our tongue. So our tongue starts becoming looser. So one of the first things patients in their 40s are always talking about is snoring, right? And that snoring over in your 40s, starts in the 40s, becomes louder in the 50s. By 60, 65, people are ending up with sleep apnea. Now, sleep apnea occurs, then comes hypertension, then diabetes, and just all sorts of different things, right? And again, that's one of the reasons I say that dentistry is one of the root causes in preventing disease and dysfunction. If we get the breastfeeding right, if we get, tongue treating exercises in our 40s, we can actually live 100, 120 without disease. Because what we're doing is form and function go together. The pathophysiology is corrected. And when we have the correct form, our body works properly. When we give it the right nutrients, the body works properly. And that's really our main focus and the roots as we speak here with dentistry. The roots are really developmental. Once mouth breathing starts, whatever the reason may be, whether it's not breastfeeding, whether it's teeth extraction, whether it's some sucking, whether it's evolution, or whether you're at an older age in life and the muscles start relaxing, all of those things end up causing mouth breathing. Mouth breathing creates a dry environment in the mouth, making bad bacteria overgrow. It also causes acid reflux, which will also cause disease, which will actually cause decay, right? And that's actually one of the biggest things. Silent reflux is a real thing. People forget to talk about it because we almost think it's natural. Oh, I ate too spicy. Oh, I didn't sleep really well. But no, actually, if this is you're noticing it once or twice a week, it's probably happening 50% more of the time. And let's look at it because before it starts becoming a real big issue, right? So that's a couple of things to say. I feel like I started with one question and answered a few, but I can't stop once I start talking about this stuff. I get so excited.
Yeah, I love it. The more information, the better. So let's pretend, actually, before we do that, I wanted to say that I also follow the work of Weston Price, who is the dentist that discovered vitamin K, which later was named so, which is connected to vitamin D absorption, which is connected to calcium absorption. And of course, that is connected to bone health and tooth health. And so he was also talking about the development of the jaws, and how we need the space in the mouth, and we need to chew hard foods. That's one of the things. And the things that you're mentioning too, like how we feed the baby and the types of foods that we eat as well, and what can cause disbalance. So let's now pretend if we can have the ideal scenario, what would you recommend that we can do from birth to growing up to keep both a healthy mouth and body?
Absolutely. That is a great question. So the first thing I would say is with babies, well, actually, let's start with pregnancy. I feel like that's the best place to start because pregnancy, gestational diabetes is very common. Gestational sleep apnea is very common. So the first thing with pregnancy is making sure you're testing the bacteria that's inside your mouth and going in for cleanings every 3 months, because there's specific bacteria that will pass through the placenta, leading to ectopic pregnancy or low birth rate and things like that. Also, make sure all your amalgams are out. There's no mercury in your mouth, no foci of infection, no failed root canals or anything like that. So start with the pregnancy and start there. Now, once you have the baby, the first thing is going to be really making sure the babies are being breastfed for 2 years. So important. And as they get their teeth, let them chew on a piece of broccoli. Let them chew properly. That chewing is really important because it activates the muscles, it activates the bone, it activates the jaws to grow properly, as well as a functional airway. And then as they get older, please avoid pacifiers. Please avoid thumb sucking. Please avoid those. Now, as the children get older and they start going to preschool or school, the things that I would recommend would be, these are a little bit outside of dentistry, but really important. Make sure the kids are showering as soon as they get home. They are having all these journeys, so making sure you're showering, getting all those bugs off of their system so they can continue to nose breathe. Because what usually happens is when they're around kids, the first thing that's going to happen is the sinuses get really filled, right? So making sure the kids are, making sure that the kids are nose breathing throughout their time, because that does lead to, if they are not, it does lead to HD. That's right, ADHD. Tongue twister there. So starting there, toothpaste wise, I like to use Hydroxy Nano Apatite. It has a wonderful product which actually helps remineralize tooth structure, and it doesn't have fluoride in it. So that's a toothpaste I would recommend. And I would also recommend that they tongue scrape or use a finger brush on the tongue to get rid of all the bacteria that's on the tongue. So that's really important starting with children. Now, as they get into their, 8 or 9 years old, do an orthodontic evaluation, go to a functional orthodontist to make sure that if they get braces, they're not getting braces that is going to cause airway problems in the future. Now, and then food wise, making sure you're avoiding like goldfish and crackers and snacking all day. If you're going to feed them 3 meals and make sure they're good. Swish out the mouth out with water. It's that constant snacking that's a problem. If you're going to give them some snacks, give them like an apple. It's self-cleansing. It's really great. The worst are peanut butter and almond butter. So if you're giving them peanut butter, almond butter, making sure they're brushing their teeth afterwards. So I would definitely recommend that from 0 to 10. Now, after, when they get into their double digits, there's hormones that are raging. There's a lot of things that are happening. So really making sure that the kids are, one most important thing is making sure they're getting nitric oxide through leafy greens. So a green smoothie, a salad, all of that stuff is going to set them up for success because they're chewing properly. They're still growing. That airway is being developed. Also, salads are really great to make sure their gut microbiome is super healthy. Also, when they're eating salads and things like that, again, their mouth is much better. They're getting out in sunlight, they're, going to their PE classes, or getting their vitamin D, which is super fantastic, really important, taking their multi-minerals and multivitamins. That's what I would recommend in those teenage years. Now, 20s, I feel like sometimes girls start contraceptives, things like that. So it does make the gums bleed more often. Their oral hygiene routine is going to be very, very, very important as they're in those years. And now 30s, they forget to go to the dentist when they start becoming 20s to 30s. People are in college, getting their first job, too busy, things like that. Super important to make sure they're going to the dentist, because gum disease starts 30s and it's silent. Nobody really knows about it, or you can't feel it, right? So really important for those pieces. 40s, critical to do like a sleep study to see what the tongue position is like, because grinding really starts happening, and that grinding is actually a functional airway problem. It's not stress. It's not, I've got a lot of things going on. Majority of the time, the grinding is the first sign that we see that there is a functional airway problem. Acid reflux starts occurring along those times because the tongue starts becoming a little loose. 45, actually late 40s, estrogen dominance. 45, we're starting seeing menopause and menopause, men and women, right? So really start seeing dry mouth that causes cavities and gum disease. So really important to start looking at those things and start adding probiotics. One of my favorite things to use is nitric oxide gum through Berkeley Life. It's a great gum. It's great to start using in your 40s. That really helps prevent disease and dysfunction, not just from the mouth, but also the rest of the body. It'll help you prevent cavities and gum disease because it's a prebiotic. 50s, again, we start seeing more dry mouth. 60s, huge decline in dry mouth. 65, sleep apnea. And then disease just go from there. So important in the later years to start adding like substitute saliva, start adding the nitric oxide gum is really important. Also making sure checking for the microbes that cause heart attack, diabetes, cancer, Alzheimer, arthritis, making sure there's no failed root canals, because if you've had something in your 30s, it will probably fail in your 40s or 50s. So really being mindful of that. And really making sure that there's no foci of infection. It's that low grade infection that's a problem. We talk about this all the time in medicine, but in dentistry, it's the same thing. When there is a root canal that's failed over a long period of time, that's when we hear that, hey, there's a higher risk of breast cancer or different cancers. It's because there's this low grade infection that's been happening for 5 to 10 years and not caught earlier.
Okay, wow, that was such a wonderful synopsis. And I would add a few things. I'm sure you can add a ton of things too. So no gummies of any kind. I actually learned that the hard way with my son, unfortunately, because I would give him organic gummy vitamins. All right. Then I also learned through Weston A Price about sources of vitamin K in foods, vitamin K2 that is specifically, and those would be like cod liver or other sorts of animal and fatty product butter. You can also take it as a supplement as well, but that's like the key thing too in the jaw and tooth development, as we were talking about. And I'm hearing you say that some of the most commonly known root causes of tooth decay are the acid in the mouth and also the dryness in the mouth. And by the way, medications, also watch out for medications. Yes. A lot of them can cause dryness, the anticholinergics. And then the second thing is like the microbiome, right? Like bacteria, the wrong type of bacteria. So could you talk to us a little bit about your approach in green dentistry, like to the bacteria, germ versus terrain, and how do we keep that healthy?
Yes, absolutely. That's a great question. And I'm really glad you brought up the pharmacology of things, because there's a lot of medications with a lot of side effects. Some of them actually cause, actually deterioration of the bone as well, not just, dry mouth. And so it's really important. And the way I wanted to start off is like, my goal would be that people wouldn't go on those pharmacologies, right? Like, let's be preventative and really look at how can we use herbs, how can we use natural modalities of our bodies working, and food, like you mentioned. Thank you so much for doing that. And I absolutely agree. That's the best way to start off. But as we're looking at, people and disease. And what I would say with these is there's so many different medications that cause so many different problems. Grinding causes cracked teeth, right? Some of the medications will cause that. Some of the medications will cause, obviously, the dry mouth, as we talked about. Some of the medications will also cause a decrease in vitamin D absorption, which is really important. I know you mentioned K2, but we always need D3 to go with K2, and then we need magnesium as part of that as well. So any medication that has a side effect that is going to limit any of these is going to be a huge concern for us. And when we're looking at it, each person is so different. When they come into our practice, what we do is look at a thorough medical history, of course, but we take it a step further and we start looking at their genetics. We start looking at their interleukin 6. What I want to do is look at their interleukin 6. Are you at high risk, low risk, or medium risk for inflammatory diseases? Because that's really going to help me customize my care for you. And then I add in another layer with that, with looking at the oral microbiome, looking at their 13 species of bacteria that we know are known to penetrate the brain, are known to penetrate the heart, and really looking at how can we eradicate these guys. Thirdly, we do a nitric oxide test to see what is the nitric oxide level in the mouth. We can actually test that with test strips and see where someone stands and give supplementation based upon that. And then we also look at the tongue position. Now, the tongue position is really important in really making sure that the tongue rests at the roof of the palate. And the reason for that is it does help activate that vagus nerve. It does help that rest and digest, especially as we get older. One of the things you find in yoga is they always tell you to put your tongue at the roof of the palate, right? And the reason for that is that the breath you get is a different quality breath. And also using our the way our body works, let's activate it. Let's decrease that stress. Let's make sure that it's working properly. So those are some things that we look at. We look at CT scans to see if there's any sort of foci of infection. Even if there's a smallest foci of infection, we can find it. We can see the bacteria that are inside there. And if there's an old failing root canal, of course, any mercury that needs to get cleaned out. Also in the sinuses, people always forget to look at mold. Now, mold tends to stay in the sinuses, and ENTs are more like, if it's really bad, we'll do surgery on it. But believe it or not, if we expand your upper palate and put it in the right place, we can start getting that mold to drain out with some zeolite and some detoxifiers and binders. So we're actually able to do that as well. If somebody came to me in the practice, we would do some data-driven information. We would look at, just like the blood serum, we'd look at saliva, we'd look at genetics to customize their medical history. Also 3D and who they are and their lifestyles. One of the things I hear, even with people who are using like apple cider vinegar, fantastic, natural way, but what we find is that they end up with a lot of cavities, because they're not drinking it through a straw. So again, looking at lifestyles and really looking at a person holistically and really giving recommendations that are based upon that.
Yeah, thank you so much for sharing your approach. So let's say somebody comes in and they have tooth decay going on, cavities, maybe even a root canal if it's an adult. What ways would you recommend they approach their oral microbiome and then start to rebuild maybe some enamel, or, what's your approach with all that?
Yeah. So if somebody has root canals, has gum disease, or some bacteria and stuff like that, the first thing we want to figure out is, where is that coming from, right? Is it just acid reflux? Is it that they're not brushing their teeth? Or is it, sometimes anti-anxiety medications, just like, let's figure out where the root cause really is. And then once we address the root cause, the first thing I would do, analyze the bacteria in the mouth. While that's getting done, I would get if there's an infection like a root canal. Root canals are okay if they're done properly. They need to be done with lasers. Lasers actually eradicate those bad bacteria that we were talking about, and like you've read about failed root canals and those foci of infection. If we do root canals with a laser, and chloride and different mechanisms, we are actually able to clean the canals really well. And we use an electric filler, which turns the Get-A-Purge into a liquid so that there's a really nice seal. Those root canals are safe and work really well. We like to keep the teeth because the teeth have periodontal ligaments at the roots, and those are stem cell activators pretty much. And so that's one of the reasons we like to keep the tooth, especially if the root canal can be done safely. If the root canal is not done with a microscope and not done with lasers, don't do it. It's just going to end up with a focal infection and systemic disease down the road. So that's, the first thing that I would look at. Test the bacteria. Let's look at the root canal. If there's decay, that needs to be completed. First and foremost, I would also always make sure the gums are clean first, and there are no bacteria, microscopic bacteria that cause any of the diseases. The reason being is that if you put a filling on there, if there's a hole, you put a filling. Now, if you still have these microscopic bacteria, what's going to happen is the seal is not great. So what happens is in 2 years, that filling will need to get redone versus you get rid of the bacteria properly, and then you put a nice seal on it, you put a filling or a crown or whatever is needed, you do that. And that actually helps maintain it much, much, much better and longer for you. So we start with the foundation up. Now, as far as, once treatment is completed, the first thing I would do is make sure that they're on some supplements. I always love a probiotic and a lozenge. The reason I love the Berkeley Life nitric oxide gum is because that is a prebiotic. It gives you nitric oxide. It makes you salivate, so you get saliva in there, so it'll flush out any bacteria that's in your mouth. And also, it allows good bacteria to survive. That's the main reason I love that gum. Secondly, I may also recommend, depending on their microbiome, one of the other ones that I love is a lozenge through BioGaia. And earlier we talked about vitamin D and K2 and things like that. So I really like, if somebody has a high predisposition for inflammation, I really like utilizing BioGaia. Osfortis is really fantastic because it helps with bone density and also calcification. So I really enjoyed that one. We also look at if they need magnesium. Magnesium is great for sleep. If somebody had, is having a lot of acid reflux, is it because maybe, they're drinking too much coffee because they're an attorney and they're stressed out all the time? I would want a cortisol absorber for them before they go to sleep at night. So I would put them on a cortisol absorber and magnesium. BioOptimizers is the one that I really like. The cortisol absorber, I believe, is cortisol manager is the one that I really love. I have them take that before they go to sleep so they get good sleep, breathing through the nose, mouth taping their mouth, and it works really well. Toothpaste wise, I figure out what they need. If they just need remineralization, I would do one of my favorites is Boca, BOKA. It has hydroxynanoapatite in it. But if they have a biofilm problem, I would go with Biocidin or dental Dentalcidin. And the reason I like dental Dentalcidin is because it stops the biofilm from forming. And that is really important because, again, we're getting things at the root. If the biofilm is just bad, and I see this a lot in my older patients because they're above 60s, I like to use the dental Dentalcidin to make sure that the bacteria is removed and stays removed for a long period of time. So that's what I would recommend for them as far as tricks and tips there. And then the other one that I really, 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 really love is Beet NO2. Beet NO2 is really fantastic for my people who are, need to work out all the time. I say take this before you go to the gym. A ton of, bioavailable nitric oxide. So it's going to do a world of wonder for their mouth and the rest of their body and their gut. Also gets it into the bloodstream right off the bat. They get a better workout, have more energy, and we're just optimizing them. So I really like to use Beet NO2 as well. And it's easy to take, and easy to incorporate part of our lifestyles.
Yeah, you know what? I was just thinking about the nitric oxide question, and I often think, well, can we use foods instead of supplements? So like beets and arugula and other sorts of vegetables that contain nitrogen. And then also I use tongue scraping as per the Ayurvedic protocols. And also I have been using dental Sidon for my kids and myself too, to support our microbiome and our teeth health. So I'm so glad that you're bringing all this up. Now, we are coming to the end of the episode, so I don't want to leave without addressing some controversial topics. And so I'd love like quick takes on all the things in the media nowadays that we're discussing, like fluoride, and is there a role for antibiotics, and what to do with the, wisdom teeth. Do you standardly take them out or not? And then root canals. Like, so if you can quickly give us your take on those things.
So first and foremost, I feel like I'm going to start with the root canal. If they're done safely through laser therapy, they're safe. And then just make sure they're being checked out with a CBCT at least once a year. So if there's any foci of infection or cracked tooth, we can check that out. Fluoride, fluoride tends to be more of a thing for a lower socioeconomic background, which helps prevent decay. 1 part per million, for a majority of the population, it's going to be okay. But there is a group of population it's not okay for. And remember, I talked to you about the interleukin-6, those portion of the population that's predisposed to disease. And for those, I would not recommend it. We just have better alternatives now. So I just say, why even deal with fluoride? Because if we have hydroxynanoapatite, which worked really great and helped mineralize natural tooth structure. So those would be the biggest thing that I would say with fluoride. And then what were the other things you were asking about? Sorry, I forgot.
Yeah, that's okay. So let me just ask a quick follow-up about the root canal. So many people, have now been uncovering that it is connected to systemic health with the infection leading to the places that you talked about and how it's all connected. But, if there is a need that somebody has a very big and deep cavity and tooth is decaying, and let's say they got a normal root canal done. So what can they do? Should they be checking, like you said, and hoping? Should they be redoing it? Like, what should be the best strategy, and how to prevent new ones?
Yeah, absolutely. If you have a root canal that's been placed already, the most important is a CBCT. So we can see a foci of infection there. That's number one. If you have more than 3 and you have a systemic disease, you need to go see a specialist right off the bat, get them out and get them redone, because that's definitely a foci of infection. So especially Alzheimer's, any cancer, anything like that, definitely want those guys out ASAP and redone to current standard protocol, because they've probably been there for a while. Now, to prevention-wise, the biggest thing that we need to really look at is where did the root canal come from? Is it because you weren't brushing? Did you crack your tooth? That's one of the biggest reasons for needing a root canal, because it cracked at the gum line and into the nerve. Or is it acid reflux? Is it medications? What is really the root cause? So addressing that root cause. Once you fix the root cause, you shouldn't get any more decay as long as you're brushing, flossing, coming in using some supplementation, like we talked about with the nitric oxide, or prebiotics and lozenges. If it's dry mouth, there's a substitute saliva that can be utilized. So let's really figure out what the root cause is and then address that. And not just brushing and flossing isn't the only thing. We got to look at the medical condition that caused it. If we look at the medical condition that caused it and address it, then we're in really good shape. And then you had mentioned antibiotics earlier too. So I am not a big user of antibiotics. I am all about probiotics and laser and ozone therapy. That tends to work really, really, really well in lieu of antibiotics. So, when I talked about these specific bacteria that cause heart attack, diabetes, cancer, Alzheimer, arthritis that are in the mouth and the saliva, so one of the protocol is to remove them through antibiotics. I usually don't recommend that. I usually do lasers, ozone, iodine first, and then I retest to make sure that they're gone. If they're not gone, I pretty much know that this person either has a tumor, either has something else that's growing systemically. So I really need to direct them to the medical doctors and say, hey, you guys need to dig deeper here, because if I've cleaned this up and I'm testing the saliva, which is a secretory fluid, and I'm still finding these bugs in there, this doesn't make any sense. We've got to go deeper and look at what the root cause is, and let's make sure we address that. That's typically what we do. There are instances that I do prescribe antibiotics, and it is in those patients if they have cancer. And pretty much, we've been spot on, either a benign tumor, either some sort of a OMA is the right way to say it. Sometimes lingering diabetes, something else is really going on, or pre-diabetes that's really going on that we really need to address. So in those patients, we do the antibiotic treatment 7 to 10 days with probiotics. So it's not just antibiotics, we use probiotics in dental side, and actually it's a really great product that I like to use. So it doesn't make the body resistant to the antibiotic, and it works much better. So I really like to use that. And then we retest them to make sure that the bacteria is really gone. And then also work with their physicians or longevity doctors to really look at what's the root cause, how can we continue to support them. And with those patients, I always say 3-month cleaning. 6 months is way too long. That idea of getting cleaning 6 months is way outdated. From a holistic perspective, we want to do cleanings every 3 months because the biofilm develops. We want to make sure we get rid of the biofilm before it turns into something pathogenic.
Yeah, thank you for that. And the last question I had was about wisdom teeth. Do you suggest prophylactically taking them out for people? Should we be trying to expand our jaws? Like, what's your take on that?
That is a great question, and especially if you have a little one, I would say keep the wisdom teeth. Wait for them to grow. Like our skull is still growing till the age of 25, right? So if I had a preference and it was my child, what I would do is I would wait for braces. Because a lot of times the jaws, like this early intervention with braces is just a huge issue. And so let their bodies grow the way that they need to, unless you've got class 3 bite where the upper jaw is too small and the lower jaw is bigger. Then we want to start with myofunctional therapy, things like that. That's a lot more natural rather than, going to extracting teeth and slapping braces on. What we also like to do is with the jaws, let's develop them, let's expand them. And that's actually what I specialize in, is expanding the upper and the lower jaws by activating the stem cells that are in the periodontal ligament. That's the reason why I want to keep the teeth for as long as possible. And we 3D expand the upper jaw, which 3D expands the nasal volume. We 3D expand the lower jaw, which allows the wisdom teeth to come in, and also the functional airway, the windpipe, has enough space. So those are the things that we're looking at. And I do want to bring up one more thing that we haven't touched upon that's also really important to look at is tongue ties. We only looked at tongue ties for children, but we really need to be looking at tongue ties for adults as well. I'm finding that a lot of women trying to get pregnant. Remember earlier I said that tongue helps stay at the roof of the palate, activates the vagus nerve, helps deal with our stress, all this good stuff. We're finding that a lot of disease also happens, especially stomach issues are all actually related to, or intestine issues are related to the tongue not having enough space, and the patients having tongue tie issues. And especially the younger children with celiac disease and things like that, where we're finding a lot of it has to do with the tongue position and the tongue not being able to stretch as much as it needs to for proper function. So.
Wow. Well, Dr. Nammy, thank you so much for sharing all your wisdom with us today. If you have just one more minute, can we do a little rapid fire roundup?
Yeah, okay. Absolutely. Hopefully this was interesting.
This was amazing. So question number 1, what's the number 1 thing people can do right now to improve their oral health?
The best thing to do is going to be, I'm not even going to say brushing and flossing because it's so basic and so outdated. I would say mouth tape.
Okay, beautiful. Question 2, tell us something fun, like a hobby that you have or something surprising about yourself.
Oh, I love teeth. That's such a funny thing to say, but what I would say? Yeah, I'm just purpose driven. I'm just really happy. I'm happy on the inside out. I do this because I want to. I love it. I have a great life. I feel really blessed. Something fun and interesting. I still love racing cars.
Cool. Awesome. All right. Thanks for sharing. And then the last question I have for you is what's your advice for other dentists or even people that are looking to explore a more holistic approach to dental care?
The first thing I would say is look someone up in holistic health. Actually, let me rephrase that. You can go to my website, drnammypatel.com. I actually have courses for you. So you can actually go through a course and look at the oral systemic connection. It's a great course. It's super easy. And you really get to learn about how the mouth is related to the rest of the body. From then on, reach out to us. Happy to answer any questions. If you're a dentist, would love to help train you because this is really important. We must do this as a profession to help everyone. And, dentistry is part of medicine, and it's important that we think like doctors, not just dentists, but let's think like doctors and really, sit at the table and serve our patients.
Love it. So finally, please tell our listeners where they can learn more about you and your work. I think you just did that. But anything else about how you practice? You mentioned telehealth. Like, what kind of things can they look you up for?
You can look me up on my business site is SF Green Dentist, SF in San Francisco, Green, GREEN dentist.com. We can do telehealth. We can do oral microbiome testing. We can do myofunctional therapy. We can analyze CBCTs. There's so many things that we can do. We can do a comprehensive medical analysis. I can give you directions on what you need to do if you're not local, what to do, where you're at, and where to find the resources. So personalized, customized care. If you're a professional and you want to learn more about what oral systemic connection is, you can go to drnammypatel.com, and you can see the courses are there. But also, like, the SF Green Dentist website is really great. There's podcasts on it, there's videos, there's so many different things that we can look up, and you can pretty much find an answer to a lot of the things that are going on in the dental world right now and medical world. So.
All right, beautiful. Well, thank you so much again. I learned a lot, and I'm going to look you up and learn as much as I can. And yeah, maybe you'll be back someday to tell us the latest and greatest.
Yeah, I would love that. Thank you.
All right, take good care. Bye.
Bye.